name's Lee. Today we'll be doing a posterior pelvic tilt stabilized unsupported foot taps. This point of this exercise is to be strengthening your core muscles. There's the superior and the D muscles, so there's 9 total that we'll be strengthening. We'll be doing the rectus abdominis, the transverse abdominis, your internal external obliques, rectus capitis, longus coli, deep rotators, multifidus, and the quadratus laborum. So what we're gonna go ahead and do, momentarily I'm gonna have you lay on your back or in supine position, and I'll have you just have your knees bent. Then what we're gonna focus on is tightening our core. We're gonna be engaging our core the whole time. And then for the posterior pelvic tilt, I'm gonna guide you to push your kind of back into the table, and then you're gonna wanna maintain the tightened core and that posterior pelvic tilt the whole time. When we're ready, I'll have you raise your legs into the air, and then we're just gonna one by one put one leg down, then bring it up, and then go down with the other. We're gonna do 2 sets of 10 reps. Then we're gonna have a 30-second rest period. Do you have any questions before we begin?
Nope.
All right, so first I'll demonstrate it for you so you can get an idea of what this is gonna look like. So I'm gonna have you come down. You're gonna lay here on your back. Okay, and then just use whatever you have to kind of help maintain your core, but make sure your core is engaged the whole time. And then for the posterior pelvic tilt, I'll probably have my hand underneath your back to feel for it, but you'll wanna just kind of roll your hips back. Make sure your back is flat against the table. And then when you're ready, you're gonna have your legs come up like this, engaging everything, keeping that back flat, and then you're just gonna come down. So that would be 1, this would be 2, and we're gonna do that all the way up till 10, okay?
Okay.
And then once you do that first group of 10, I'll have you rest for 30 seconds, and then we'll do another 10.
Okay.
Yes, please take your shoes off. Just go ahead and put them under the table for me. Perfect. And then you can have that, use that pillow to help support your head. And we're also going to be making sure we don't watch her head come up and off the pillow, because we don't want any of those kind of substitutions. We also want to make sure that the pelvis is engaged the whole time and it doesn't start to roll forward into an anterior pelvic tilt. So go ahead and when you're ready, tighten up your core for me. And then, is it okay if I touch you?
Yeah.
All right, I'm just put my hand here, and then go ahead and try and roll your hips back as if you're trying to push them into my hand there. Perfect. Hold that the whole time for me. And when you're ready, you're gonna go ahead and bring both your legs up. And you're gonna hold it there, and then whatever leg you wanna start with, you're gonna come down and tap on the table. You could probably bring your legs down a little bit. You don't have to go as high. There you go, so that'd be 1. Make sure you're keeping that core engaged, making sure that her pelvis is still in that posterior tilt. Good. You feeling okay?
Yeah.
Keep breathing for me. Make sure you're not holding your breath at all. You're not having any pain, correct?
No.
Okay. All right. How many have you done already?
That was about, this is 6.
6? Okay, good. A couple more for me. Nice, good. There's no rotation in the hips at all, no trunk movement, which is great as well. You don't want any of those substitutions to happen. All right, perfect. Last one. Is that 10?
Yeah.
All right, now you can go ahead and rest. Go ahead and relax everything. We're gonna go ahead and rest for 30 seconds here. Still okay, no pain, no issues while doing that? Not having any issues? Okay, perfect. And you stayed in good alignment in the sagittal plane, which is perfect. And again, we're engaging the core. That is the point of the exercise, is to strengthen our core while maintaining the posterior pelvic tilt, which it did look like you maintained the whole time, which is great. So we're just gonna ask you to do that all again for our second rep here of 10 taps in about 4 seconds. We're gonna begin again. Okay, perfect. So when you're ready, make sure you tighten your core. And then I'm gonna feel again to make sure you bring that,
Okay.
go ahead and bring your, to the table. Perfect. Bring both legs up. You don't have to go too high if you don't want to. And then whenever you're ready, maintain that core and posterior pelvic tilt, and then tap down. Okay, that's 1. Perfect. Make sure you keep breathing. All right, perfect. Nothing's coming out of alignment. She looks good, engaging that core and that posterior pelvic tilt. I don't see her hips going forward at all, which is great. Still doing okay?
Yeah.
No pain?
Nope.
Okay, perfect. About halfway through?
Yeah.
All right, good. Maintain that breathing. Breathe normal. Don't hold your breath. Perfect. Very good. All right, are we on our last one now?
That was it.
That was it?
Yeah.
All right, good. You can go ahead and relax. How do you feel after that? Feel okay?
Yeah.
You feel some fatigue since we did that?
A little bit, yeah.
Good, that was the goal. All right, you can go ahead and roll on your side slowly.
Mhm.
No, you're okay. As long as you're okay, you don't feel
Yeah.
dizzy at all?
No.
Okay, perfect. Well, good job today. That was the end of our session.